My name is Amy Durrett. I am a radiologic technologist, otherwise known as an X-ray tech at Social Hospital. I have worked here as an X-ray tech for 16 years. My mother is a LPN, decided to start working here at the hospital when I was 16 in the cafeteria, so I got to see a lot of different stuff. When I turned 18, I got a job in the radiology department, in the MRI department actually, as a tech aide. So what I did was change and safety interview people for going into the MRI unit. What inspired me was just applying for the job as an MRI tech aide and seeing what this department does. So starting in the MRI department, those MRI techs are all started off as X-ray techs. And then they trained, went to another year of school, took another board to become an X-ray tech, an MRI technologist. And what that is the X-ray technologist. You can go into so many different fields with this degree and train in many different modalities of the radiology department, like CAT scan, ultrasound. Ultrasound, you can go to a specific school just for ultrasound and skip the X-ray. Mammography, MRI, like I said, nuclear medicine, PET imaging, which is a combination of CT and nuclear medicine, interventional, cardiology, the cardiac cath lab. There's a lot of different modalities you can do with this education. It's a pretty stressful job. When they order an X-ray, usually it's a now type of thing. So that can be kind of stressful. Right now we're in desperate need of X-ray techs, all imaging, all across the board. So it's a hot job to look into in training, and you can make some pretty good money pretty much right out of school. My favorite aspects of the job is that it's technology, right? Technology is ever changing. When I first started X-ray, we had film. You put it through a film processor and it came out the other side after going to the developer and all these other chemicals. And we had a piece of film that we went and hung up against a light so we could see it. Now everything's on the computer. And that is ever changing, and it's pretty amazing how fast things have changed in the last 15 years since I started. And to be a part of that is pretty incredible, to see how you can update the clinical setting for a patient.
My name is Sarah Gemlow. I live in Fort Collins, Colorado, and I am a phlebotomist and center supervisor at a plasma donation center. I have worked at the center for a little under 3 years now, and I never thought that I would go into the medical field. The medical career that I'm in right now, I kind of stumbled upon when I was moving to Colorado and I needed a different job. I had donated plasma as a college student, and when I saw that there was an opening at a plasma donation center, I thought that it would be a good idea to try that out. And it has been one of the most rewarding jobs that I've ever had. At our center, we use plasmapheresis machines to take whole blood from donors. Our machine then separates the blood cells from the plasma. The red blood cells without the plasma are then given back to the donors at 2 to 4 minute intervals throughout the process, and then the plasma from those red blood cells is collected into a container that we then freeze for about 6 to 10 days, and then we pack up and ship out to what's called our consignee out in Vienna, Austria. And once it's shipped there, it is used to make medications for people with autoimmune diseases, people who have chronic illnesses, and people who need plasma during surgery to help them kind of survive that surgery. What we've mostly been working on recently is sending off plasma from people who have been affected by the COVID virus to help create a vaccine.
Hey guys, my name is Andrea Colby. I have been a nurse for over 20 years now. I always knew I wanted to be a nurse to help people. After high school, I went to Curry College and I did major in nursing. I went there for 4 years and got a bachelor's degree in nursing. I would highly recommend doing a 4-year program if you can, because once you get out of school, it's a lot harder to go back to school. I definitely would highly recommend starting off any nursing degree, even if you want to do a specialized area like pediatrics or intensive care or emergency medicine. I would recommend doing a couple of years to get your feet wet on a med-surg floor, to absolutely get your time management skills down and just sort of get the basics down of nursing, and then you can kind of go off I absolutely love what I do. I wouldn't choose anything else for my career.
My name is Rose. I am a certified nursing assistant, or CNA, at South Shore Hospital. I have been a CNA since I was 16. Becoming a CNA is a pretty quick process. If you took a class like not in school, it would be about a year long. Being a CNA, what I do is I help patients with their activities of daily living. So I'll bring people to the bathroom, help people get washed up, give showers, change their clothes, walk people, feed people. Anything that they can't do for themselves is pretty much what we're there to help with. I absolutely love my job. I adore patients. I am in love with the elderly. I want to adopt them all. It's a problem. I really couldn't see myself doing anything else. I get a lot of joy from helping people. Like, it makes me feel good to know that what I'm doing is helping someone have an easier day. And being a nursing assistant during the pandemic really solidified that this is something that I wanted to do. So I'm really appreciative that I took my time and was able to realize that this is definitely the choice for me.
Hi, my name is Joe Howley. That's Mr. Thrifty. I'm Joe Howley. I'm a physical therapist. I live in East Bridgewater. I work in West Bridgewater. I've been a physical therapist for about 29 years. I took all the regular classes, but I concentrated on the sciences, especially physics, chemistry, and anatomy. And then you guys want to know, did I know what I want to do, want to go in the medical field in high school? I probably decided that in my junior year when I joined the Army Reserve, and I got into the medical profession there. And then I went on to attend Northeastern University, and I got my Bachelor's of Science in Physical Therapy. At this time, they require people to get their doctorate in physical therapy. So the normal bachelor's is 4 years. Now the doctorate degree in physical therapy takes about 7 years. Then you guys want to know, can I explain the process of becoming a physical therapist? So first you got to get accepted to a school. So you have to work very hard in high school, obviously, and take the proper classes again in the sciences. And then you got to study real hard while you're in college to do that. In college, you take lots of physical therapy courses, lots of science courses. Initially, it's the general sciences like chemistry, biology, like I said, physics.
My name is Cheryl Smith. I'm a registered nurse at South Shore Hospital. I have been a registered nurse for over 30 years of my life. During my career, I have done many things such as rehab, physical therapy, nursing homes, ER, pain clinic, etc. But what I'm doing at the present time is I am a pain clinic nurse, as well as I am a SANE nurse, which is a sexual assault nurse examiner, where I give trauma-informed, compassionate care to anyone who undergoes a sexual assault. During this time, while I was in the ER, I met a couple of nurses who were SANE nurses and got certified in SANE, and now that's what I do as a part-time job. If during your nursing career, you can have many opportunities throughout your career. I started as a nursing assistant in a nursing home when I was in high school, and that's what made me want to go into nursing. I didn't initially go to college for nursing. I went for biology and thought that I would do the pre-med route. Quite didn't work that way. I left school, and then I became an activities director for an Alzheimer's daycare. And that's when I went to Brockton School of Nursing and continued being the activities director for the daycare. From there, I went on and got my bachelor's at Curry College and continued on and still pursuing my master's. But just for all of you to know that there are many avenues in nursing. What's great about nursing is that as a mother, you can change your position throughout your career, and you can also educate yourself in many different avenues. How I got to the pain clinic was I had a patient who was in the ER, and I wanted to know what they actually did up there. So I carried the patient up to the pain clinic, and that's where I found out what they did. And I got a part-time job there, and that's how I became here. I want you all to know that as you take this journey into some form of medical, you will learn something every single day. And my biggest thing I love about nursing is that you give to the community. You're able to help out with schools, you're able to help out with your community, such as giving free vaccines and all of that. So please, if any questions or concerns, ask us and we will be more than willing to tell you.
Hi, my name's Julianne Ryan. I'm a former ICU nurse, currently in grad school to become a nurse anesthetist, and I graduate in a couple of weeks. To become a nurse anesthetist, or a CRNA, you first need to complete a nursing program, get your RN license, and then work in an intensive care unit for at least 1 year before applying to school. I personally completed a 4-year bachelor's program at Northeastern University in Boston, then worked as an ICU nurse for over 3 years before applying to school. Anesthesia is just one of the many specialties you can go into as a nurse. There are many different options. CRNA programs range from 28 to 36 months of classes and clinical experiences. CRNAs provide anesthesia for patients undergoing surgery or various procedures. We place and keep patients under anesthesia with various medications, intubate and extubate patients, which is to place and remove breathing tubes, place invasive lines that are used to administer critical medications, and monitor patients' vital signs throughout their surgeries, among many other things. I always knew I wanted to become a nurse, as my mom was a nurse and her mom was too. However, I didn't know much about the anesthesia field until I became an ICU nurse, and I would get patients brought to me from the OR from CRNAs. As I mentioned, I completed my undergrad nursing degree at Northeastern, and I'm now there for grad school. Northeastern has a co-op program in your undergrad years where you can work in your field and get paid for it as part of your curriculum. I did one of my co-ops working as a nursing assistant in one of the ICUs at MGH, and that connection is how I ended up working in that ICU as a nurse later on. As an ICU nurse, I cared for 1 to 2 critically ill patients each shift, monitoring and treating their vital signs and helping the patients with the necessary activities of daily living. It's been a long path to get to where I am now, and it hasn't been without challenges. It's a rigorous graduate program, and I've had to dedicate most of my time to school and clinical work for the past few years. However, it's definitely worth it. While I enjoyed bedside ICU nursing, I'm excited to have more autonomy and to work in the OR as a CRNA. It requires constant vigilance and critical thinking, which can be both mentally and physically exhausting, but it's also very rewarding. It's a very cool and exciting.
Radiologist, my job revolves around taking people through a surgical intervention and having them go through that safely, obviously comfortably, without having any memory of an operation. Those are some of the challenges I do every day. Anesthesia allows you also to take part in different kinds of patients, meaning you could do pediatrics one day, you could be involved in childbirth the next day, certainly people of senior citizens, different kinds of surgeries, lung surgery, abdominal surgery, craniotomies, and neurosurgery. So there's a wide variety of challenges, one of the things I really enjoy about my job. But getting good grades and doing well on standardized testing will be super helpful to get you forward as you're heading toward medical school. At least a 16-year process to get to where you want to go, which seems daunting when you first start out, but at all points along the way, you're working hard, you're challenged, you're with friends and colleagues, and as they say, it's about the journey and not the end a lot of the times. I thought I was involved early on in some of the really challenging circumstances that occur with patients. You know, you might be involved in giving somebody a diagnosis of cancer or doing CPR on somebody with chest compressions, and be involved in childbirth. I think another challenge is, you know, being with the best and the brightest and the hardest working students, and then at the end of it finding out that you probably are one of the best and the brightest and one of the hardest working students as well. So that was really satisfying. But it can be intimidating to be with a lot of smart people, all who want to work really hard and can study and learn and maybe do better than you, and you have to sort of be ready for that. Was it worth it? Absolutely. I certainly would recommend that you never go into medicine just because you're not sure what you want to do and because you're pretty smart and you can do well on tests and get good grades. It's just way too hard a process if it's not something that you really want to do or find as a passion. But if it's for you, you'll have a demanding and satisfying job for the rest of your life with great job security, good pay, and the ability to do your job in just about any place in this country, at different levels, different hospitals, surgical centers, teaching centers, so it's really a worthwhile profession to consider. My tips in terms of how to begin the process of heading in the direction of a medical career: get involved in something medical early if you can. Volunteer, work as a transporter in a hospital, go to a senior center, take a life-saving course, shadow a physician or a nurse or someone in the medical field. Not only is it good for your application, which is a great thing, but you also find out if you really enjoy being around patients and people who need your help. Last thing I wanted to say, that, you know, even though I certainly made the right choice of becoming an anesthesiologist, and it's something I've really enjoyed for many, many years, there's so many ways to be involved in medicine. Obviously the various other medical subspecialties, surgery and pediatrics and psychiatry and childbirth and so on, but there's nursing, physician's assistant, technology with x-ray techs and MRI techs and blood drawing techs and dialysis techs. There's people that need to do the infrastructure of the buildings, so medicine involves, you know, highly specialized labor to build hospitals, build the facilities with the different safety mechanisms that have to be involved. There's the business and the economics of medicine. There's supply and administration, management, fundraising. You could be an EMT in an ambulance setting. You could be in medicine in a legal setting, talking over medical legal problems or ethical issues. There's dietary, there's pharmacy, there's pathology, there's physical therapy and rehab. So there's so many ways to be involved in medicine beyond just necessarily a career as a physician, which makes it just a thing that just can really fit a lot of people that are coming through. And, you know, no matter what your aspirations are, there'll be something in medicine that should and hopefully will appeal to you. So good luck to everybody. Hope that was helpful.
My name's Angela DeRochers, and I am Director of Perioperative Services. I always knew that I wanted to help people in some way, and I think that my path definitely has changed a few times in my career. I started out actually as a surgical tech in a surgical tech program and knew that I loved the operating room, so that I continued to get my nursing degree so that I could work in the operating room as a nurse. And I actually traveled for a little while as a traveling operating room nurse, which was really interesting. And you can also travel actually as a surgical tech and travel anywhere around the country, and it's a really good experience. So then I actually ended up becoming the educator for the operating room in a hospital in Boston. And that also was interesting. And I always wondered, where do I want to go? Do I want to be management? Do I want to be educator? Because I really enjoyed both roles. So I received an opportunity for a management position at the Boston Hospital, and said, all right, let's give this a try and see how I like it. And I knew that in management, you're also an educator as well. So I continued on and became a manager, and then this opportunity came about to become Director of Perioperative Services, meaning I'm director of 5 different departments. And, that has its good days and bad. And, but it's definitely the role that I enjoy being in, because I, again, am both educator and I can help my staff to get to where they need to be so that the patient's experience is the best that it can be. I think for advice, I would definitely advise anybody that to do what they love to do, because you have to come into work every single day and you have to really love it. And finding that thing that you really love might take some time. As a director, I still am able to go in and scrub surgical cases and be the circulating nurse in the room, as well as the director, so that I have more control over, helping my staff and helping my department have what they need to succeed.
One of the reasons why I love what I do now is that I actually go to my staff members and say, hey, like, let's fix this. How can we make this work? And it's really important that you're in a place where you feel like you can speak up and say, hey, this is what's going to work best for myself and my department and my coworkers and my patients. Remember that what you do every day makes a difference no matter what field that you go into, and love it.